welcome back to my channel. I'm Nurse Alyssa, and today we're going to be talking about a very important and sometimes very serious post-surgical complication called wound dehiscence. If you're a nurse, caregiver, or a patient recovering from a surgery, this video will give you everything you need to understand what wound dehiscence is, why it happens, how to recognize it early, and what to do if it occurs, and most importantly, how to prevent it from happening in the first place. So let's get started. What is wound dehiscence? Wound dehiscence simply means the reopening or separation of a surgical incision after it's been closed. Normally, after surgery, the wound edges are brought together with sutures, staples, or glue to allow them to heal from the inside out. But with dehiscence, those edges start to pull apart partially or completely before the wound has fully healed. This can happen days or even weeks after surgery. It's most common around abdominal surgeries, but it can occur anywhere a surgical incision was made. Dehiscence can range in severity from superficial dehiscence, which affects the skin and the upper tissue layers, or deep or complete dehiscence, which means the wound has opened through all the layers, exposing muscle or even organs, which is a medical emergency. Now let's talk about why wound dehiscence occurs. Healing after surgery depends on many complex factors. Anything that disrupts healing can increase the risk of the wound reopening. So let's break it down into three main categories. One, mechanical stress, two, patient-related factors, and three, surgical or wound-related factors. Mechanical stress, so this includes excessive strain or pressure on the incision before it's fully healed. Common examples are coughing, vomiting, or sneezing forcefully, especially after abdominal or chest surgery. Lifting heavy objects too soon, sudden movement, or bending in a way that pulls on the incision. Even something as simple as getting out of bed too quickly can cause tension on the wound if it's not properly supported. Patient-related factors, certain health conditions or habits can delay wound healing. These include diabetes. So high blood sugar impairs collagen formation and tissue repair. Poor nutrition, especially low protein or vitamin C levels. Obesity, the extra fatty tissue has poor blood supply. Smoking reduces oxygen to tissues. Infection or systemic illness that slows healing. Use of steroids or immunosuppressive drugs, which interfere with the inflammatory and healing response. And of course, advanced age, which can slow recovery. Three, surgical or wound factors. So these include poor surgical techniques such as suture placement, which is too close to the edge, infection at the incision site, bacteria can destroy and weaken the wound closure, fluid or buildup underneath the wound, which adds pressure, or insufficient blood flow to the wound area. All these factors contribute to one thing, which is weakening the wound integrity, which leads to the edge separation. How to recognize wound dehiscence. So early recognition is absolute key. Here's what you might notice. The wound may appear reddened, swollen, or draining fluid. You may see a small gap forming between the incision edges. There may be increased pain, warmth, or a pulling sensation. Some people describe it as a feeling of popping or tearing when it does happen. In severe cases, you may see underlying tissue or sutures exposed. If bowel or internal tissue comes through the wound, that's called evisceration, and it is a life-threatening emergency. In that situation, cover the area immediately with sterile soaked gauze and seek emergency care right away. What to do if dehiscence occurs? If you suspect wound dehiscence, you're going to stop what you're doing immediately. Don't try to push tissues back in or close the wound yourself. Cover the wound with a sterile dressing, clean towel. Ideally, you want to moisten it with saline if tissue is exposed. Call your healthcare provider or go to the emergency department if separation is deep, bleeding, or showing signs of infection. If it's a small superficial opening, a nurse or a clinician will usually just assess it, clean it, and apply a proper dressing to promote healing by secondary intention, which means the wound will heal from the bottom up rather than being resutured. Pain management and infection control are also essential, so antibiotics may be needed if there's infection present. Prevention strategies. The good news is many cases of wound dehiscence, it can be prevented. Here's how nurses, patients, and caregivers can work together to minimize the risk. For nurses and healthcare provider, use aseptic technique during dressing changes. Monitor the wound closely for early signs of infection or tension. Reinforce the importance of supporting the incision when coughing or moving, especially for abdominal or thoracic surgeries. Ensure the patient is nutritionally supported, adequate protein, hydration, vitamin C, all promote collagen formation. And educate the patients on activity restrictions, so no heavy lifting, bending, or straining for several weeks after surgery. For patients and caregivers, keep the wound clean and dry, follow your nurse's instructions for dressing changes, avoid smoking and alcohol as they both slow down healing. Manage underlying conditions, especially blood sugar if you have diabetes. Use a pillow or small towel to gently brace your incision when you cough or sneeze. Report any new drainage, redness, or swelling immediately. Remember, prevention starts with awareness and consistency. Healing and follow-up care. Once a wound has experienced dehiscence, healing may take longer, sometimes weeks to even months, depending on the severity. Treatment may involve frequent wound assessments, negative pressure wound therapy. As you can see here in the photo, it helps draw the wound edges together. Or in some cases, they will surgically reclose the separation if they're really large. Follow-up is essential to ensure the healing process and prevent reoccurrence. Nutrition and wound healing. Nutrition plays a critical role in wound healing, and it's often overlooked. The body needs extra energy and nutrients to repair tissue, produce collagen, and fight infection. Here are some key nutrients to focus on. Protein, which is essential for building new tissues. Foods like eggs, lean meat, fish, dairy, beans, tofu, they all help rebuild the wound bed. Vitamin C supports collagen production and strengthens new tissues. It's found in oranges, strawberries, bell peppers, and broccoli. Zinc helps with cell growth and immune defense. You'll find it in meat, nuts, and whole grains. Vitamin A, it's important for immune function and skin integrity. Think carrots, sweet potatoes, and leafy greens. And lastly, hydration. Don't forget about water. Dehydration slows cellular repair and increases the risk of infection. For patients with a poor appetite or chronic illness, protein supplements or oral nutrition drinks may be recommended by a dietitian or nurse. Remember, good wound care starts on the inside, and that's why I've created my wound healing cookbook. It has a ton of recipes that all focus on the nutrition you need to support the wound healing process. To get your copy, check out the link in the description. So to recap, wound dehiscence happens when a surgical incision reopens before it's fully healed. It can be caused by mechanical stress, infection, or poor healing factors, but with proper care, nutrition, and vigilance, it's often preventable. Always remember, early detection saves complications. If something doesn't look right or feel right with your wound, seek help immediately. Thanks so much for watching, and if you found this video helpful, don't forget to like and subscribe for more educational wound care content. Stay safe, stay informed, and happy healing. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.